During our consultations here at our practice, we spend a lot of time one-on-one with the patient. So it's getting to know the patient, their personality, important things like their medical background, previous surgeries, medications, allergies, social history, things that, what do you do for work? What is your lifestyle like? Because that can help guide us into what's an appropriate operation from a recovery standpoint.
What people tell us, and we read in our reviews, and some of our patients tell us a lot, is that our consultation experience is a little bit different here at 22 than they've had elsewhere. And what is that? It's a manifestation of a number of things, one of which is that we really care. And I think that our patients can feel that when they come here. You're going to get a lot of time with myself and with Dr. Rubin. Patient education is everything. We want you to understand what the surgery is going to be like, what expectations can be, how good can we make it, or where some of that tempered expectations is maybe realistic too.
What are their goals? Really trying to clearly define what they want to achieve, make sure that those are achievable results, make sure that they're realistic results that we can help them with. And then going through the surgery, giving them all the information, details about the surgery itself, the recovery, what is the garments and the dressings and the drains, if there are any, medications, how long the recovery is going to be, kind of activities they can do at certain time points during the recovery, really outlining the total experience for the patient so they really have a good understanding of what the entire process looks like.
We take our jobs very seriously. I know certainly I do. And here at 22 Plastic Surgery, I know we're really striving to be almost like a 3 Michelin star restaurant kind of experience for our patients. We're really shooting for the stars. The best way to prepare for a consultation is definitely do some research. The more people know before the procedure, the better it goes, and the more in-depth we can get about some of the details of the procedure. The best way to do that research is honestly to look at websites of plastic surgeons, look at our website, other surgeons' websites, look on Instagram, see before and after galleries. It really helps to contextualize what we can achieve. If you look at pictures of people who maybe look similar to you and see how they look on the other side of it, what did they do? What size implant looks on one person can be very different on another. It depends on body habits and stuff like that.
Obviously, it's good to come in knowing as much information as possible, obviously about your own medical history. If you do have breast implants, knowing if you know the size, if you know the operation that you had previously, that helps us understand some of the nuances for additional procedures. List of medications, being honest with the provider about what your job entails, what kind of responsibilities you have family-wise, job-wise. Obviously, smoking history is really important to be very transparent about. The more information that the patient comes in with, actually the consultation goes a lot better. There's a lot more flow, a lot more dialogue, instead of us really just kind of dumping a lot of information on the patients, a lot of exchange of ideas and thoughts, and really making sure that we can then tailor that surgery towards that individual's goals.
The best kind of questions to come to a consultation with maybe aren't even questions. The best thing that you can do in a consultation with myself, honestly, is to come with photographs of what you would like to look like. And we can give you a roadmap for how best to get there and set expectations. How close to this can you come? How many procedures might that take? Can it be done in one, or does it need a few? And it doesn't mean that everybody needs to have what it is to get the nth degree result, because that might be a fair number of procedures. But let's say you just want to have one procedure. How close can we get you to that? It becomes a bit more artistic in that way. It's less about going to a grocery store and going for a tummy tuck or buying a head of cabbage or whatever it is. It's more like going to a chef or an artist or something like that. I'm looking to decorate my home with this, that, the other, or create a meal for this sort of family. How do we do that? Because we know a lot about what goes into these things, and some of it's not exactly clear when you go on Instagram or social media, how people got to those results. The other thing is that a lot of people, you see these results on Instagram, and it's not always apparent that there's more than one procedure there. Sometimes there's a small revision, and that's actually common. And to get people to that 100% result, sometimes small revisions are part of the game, but we try to make that experience as great for our patients as possible.